my name is Natasha Hochberg. I'm the ID Fellowship Program Director and look forward to getting to know you as part of the application process. From a clinical perspective, Boston Medical Center provides the opportunity to see a range of infectious diseases that include bread and butter ID, but also opportunistic infections associated with AIDS, tropical infections in our large immigrant and refugee population, and infections associated with substance use disorders. From a research perspective, we have 4 key areas of focus: HIV and Hep C, which includes researchers in cost-effectiveness modeling as well as epidemiology and disease pathogenesis, hospital epidemiology and antimicrobial stewardship, tuberculosis global health and travel medicine, and lastly, microbial pathogenesis and immunology. We also offer the first joint infectious disease addiction medicine fellowship in the country. Many of our faculty also have appointments at the National Emerging Infectious Diseases Laboratory, or the NEDL, on our campus, which is one of the few BSL-4 laboratories in the country. Other faculty have joint appointments at BU's School of Public Health, which is ranked by U.S. News and World Report as the 8th leading public health school in the country. Many of our fellows go on to grant-funded careers as clinician researchers or clinician educators.
Hey everyone, my name is Leah Harvey. I'm one of the current second year infectious disease and addiction medicine fellows here at BMC. I've really loved my experience here at BMC and I would choose it again in a heartbeat. I think that BMC is unique for a number of reasons, but primarily our patient population and our hospital's social mission. Boston City, what BMC used to be called, was founded back in the 19th century as the city's hospital for the poor, and it remains the largest safety net hospital in New England to date. We have large and really well-established clinics for refugees and asylees, as well as large clinics for patients with TB and with HIV. We have a very close relationship with Boston's healthcare for the homeless, and are one of the primary care providers for Boston's homeless population as well. And we're also affiliated with the Boston VA, which is the largest VA in the Northeast and serves as a tertiary referral center, so you'll see patients from all over. And the Boston VA system is also nationally ranked as one of the VAs with the best quality clinical care and patient satisfaction as well.
My name is Sabrina Sumu, and I am an infectious disease specialist in the ID section at BMC. After completing my training, I came to BMC because I wanted to work in an underserved community, and I can say that I haven't been disappointed by coming here to BMC. My work focuses on developing an intervention to improve HIV and Hep C linkage to care after testing at a drug detox center. And overall, I'm interested in addressing infectious complications of substance use, such as HIV and Hep C. The second line of work that I've been involved in while at BMC has been in collaboration with Dr. Benjamin Linus. We have used data sets to look at gaps in care related to HIV and Hep C. And we've also used cost-effectiveness analysis to inform national guidelines for HIV and for hepatitis C testing. And we're proud to say that our findings in one of the research projects that I led is currently included in the updated guidelines from the CDC and the U.S. Preventive Services Task Force, which now recommends universal Hep C testing for patients who are 18 years or older. So I must say that being at BMC has allowed me to have impactful work, not only at a local level, but also at a national level.
Hi, I'm Pranay. I'm one of the second-year infectious disease fellows at Boston Medical Center, and my experience has been amazing. I wouldn't trade it for anything. But I also want to point out that this is a fantastic place to start out your career as a clinician investigator. So when I came to BMC, all I knew was that I wanted to do TB research in India like Natasha, but I didn't know specifically what I wanted to do. And then I was given time in my first year to think about what my research priorities are, and I figured out that I wanted to do health economic modeling of the impact of undernutrition on TB in India. As you can imagine, that's a very specific topic. And I needed a team of mentors, and I was very fortunate that BMC had the breadth of research expertise to support this kind of a research endeavor. The framework of the PU Chart T32 program at BMC which provides you with salary support as well as funding for going to international and national conferences, which I've done, as well as training grants for education equipment, for example. And most importantly, they also provide funding for taking courses at a graduate level to make you a more effective researcher. Really, I have wonderful things to say about experience here as a budding clinician investigator.
Hi future colleagues, I'm Angela, one of the current ID fellows. Two of my very favorite things are global health and harm reduction, and BMC is great at both of those things. After a year of working at this hospital that I've been surrounded by staff who are passionate about meeting our patients where they're at, serving the underserved of Boston, aggressive destigmatization, and there's really no lack of harm reduction training in this fellowship. In terms of global health, our patients are immigrants and refugees and people who literally got off a plane not feeling well and show up to the BMC ER. So as a clinical ID fellow, you're going to see a wide variety of tropical diseases and things that they see all the time in other countries. As a first-year fellow, I've treated malaria, dengue, schistosomiasis, Chagas, lots of TB. And so I feel comfortable being part of the treatment team for all of those types of diseases. Figuring out my project, I discovered the wide array of global health projects that our faculty are working on. Huge variety, and everyone's very excited to work with fellows, so there's no lack of options.
Hey, my name's Kareem Khan. I'm one of the second-year infectious disease and addiction medicine fellows here at Boston Medical Center. We do a lot of inpatient consult work and then have a continuity clinic seeing HIV patients with some substance use disorders as well. Basically, a whole wide range of clinical experiences to get training in addiction medicine. And there's a lot of really great research opportunities here at Boston Medical Center, specifically for folks working at the intersection of infectious diseases and addiction medicine. My own primary interests are specifically with homeless medicine and linkage to care and the development of street medicine programs that can help transition patients between the inpatient and the outpatient world. Boston Medical Center is definitely a very exciting place, and you'll see a lot of patients at the intersection of infectious diseases and addiction medicine, and I think there's a tremendous amount of research opportunity going on. There's a lot of potential for training. There's programs like the RAMS program, which will provide you with structured mentorship.
I think that our diverse and underserved patient population and our hospital's very strong social mission really make this a singular place to train. I've loved it here, and I think that you will too.
And there's a lot of experts who are eager to help mentor and guide you in your early stages of your career.
And as you go through your search for a fellowship, I wish you the best of luck, and I'm sure you're going to do great.
I hope that you get a chance to look around the website and understand the many aspects of our program. Please reach out if you have questions. We'd love to tell you more about our program.